welcome to my channel. My name is Jazzy RN. If you are new here, welcome, and if you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And just a little background about me, I have 9+ years experience working in utilization review, and I've worked for 3 different companies, and the goal of my channel is to help nurses pivot from the bedside to remote work. This first company is called Cerner. I have 3 positions for them. And the first position is integrated nurse case manager. This is for RNs. For inpatient and outpatient clinical appeals, you will work remotely in the state of Virginia. This job was posted on March 26th. It is a permanent full-time position, 40 hours a week. The work hours are from 8 a.m. to 5 p.m. Eastern Standard Time, and that is Monday through Friday. You must have at least an RN diploma, and a bachelor's degree in nursing is preferred. You must have either a compact or Virginia license is preferred. 3 years experience in nursing is required, and case management experience is preferred. The next job is a authorization coordinator. This is for LPNs, and this is also remote in the state of Virginia. This was posted on March 26th. It is full-time. That's 40 hours a week. You will start from 8 a.m. to 5 p.m. Eastern Standard Time, and that is Monday through Friday. You must be an LPN with a compact or multi-state license is required. Related experience is 3 years. Health plan or utilization management experience is preferred, not required. JIVA and Milliman Care Guidelines experience is preferred. Related experience is an LPN, such as experience in a physician office, acute care, managed care, or clinical setting, and prior authorization. And the last position with Cerner is a remote medical assistant. This is for telehealth services. You will work remotely. This job was posted on March 24th. For this position, you must have at least a high school diploma, and certification or licensure includes a CCMA, CMA, RMA, EMTB, or Paramedics certifications required, and no experience is required. The next company is with Cardinal Health. Now, Cardinal Health is an international company, as you see here. And the first position I have is for a nurse, individualized care. The job was posted on March 27th. This is a full-time role, and you must be in the United States. I want to go straight to the qualifications or requirements. And for this job, you must be an RN. The current unrestricted California license is required. 5 years experience, hospital or clinical, involving patients with complex chronic disease states preferred. Care management experience is strongly preferred. Oncology experience is a plus. Strong working knowledge and basic medical management of chronic disease states. Experience with Microsoft Office products. Make sure this is placed on your resume. Basic computer skills, including previous work with an electronic health record and Excel spreadsheets. Make sure that whenever you are creating your resume or updating it, you want to focus on and promote any tech skills you have. And regarding the Excel spreadsheets, the companies I've worked for, you're not doing any kind of Excel advanced editing of Excel sheets. Basically, you're looking at the Excel sheet and you may be copying and pasting things from there. You may be entering maybe the dates and times you start an authorization and then when you finish. But it's in no sense of any advanced Excel features. Superior communication skills to include verbal and written. Must be able to work collaboratively, team focus, and excellent organizational skills. Bilingual skills is a plus. And then the next position is a senior nurse, individualized care. This one has almost the same exact qualifications, but for this job, they require you to have an unrestricted Florida or multi-state compact license, 5 years experience, hospital or clinical, involving patients with complex disease states preferred. Care management experience is strongly preferred. Oncology patient experience is a plus. Strong working knowledge and basic medical management of chronic disease states. Experience with Microsoft Office products. Basic computer skills, including previous work with an electronic health record and Excel spreadsheets. Superior communication skills to include verbal and written. Must be able to work collaboratively, team focus, excellent organizational skills, and bilingual skills is a plus. If you look at the description box below, you'll see a link to the Cure to Bedside Burnout. I have at least 90 or more companies that hires nurses to work remotely. Most of these companies hire nurses to work as a remote nurse in the United States. There are some companies that hire nurses remotely in different countries, such as Australia, the Philippines, Canada, UK, I believe some other countries as well. If you scroll more towards the bottom of this list, you'll see where you can do your own due diligence regarding each company you're applying to. You can try Glassdoor as well as Reddit. Reddit has a couple of threads. I like the Remote Nursing Job Board and Remote Nursing thread. There's also Comparably, Team Blind, and Fishbowl. The next one is Remote Nursing, the Cure to Bedside Burnout. I have a learning course on Udemy, and this mostly goes over interqual, MCG, your resume, as well as the best questions and answers, the questions and rationale of the questions whenever you are in an interview process with HR and hiring manager. The next one is a list of office essentials. I have basically all these office essentials at home except for this one. Mine is a little bit different than I have here listed on this Amazon link, and it is an affiliate link. I get a little bit of commission if you were to buy anything on here, but I do highly recommend this memory seat cushion, which is perfect for any chair you purchase. So it doesn't matter if your chair is very expensive or you just get a regular cheap chair from any big box store. This is a great addition to have to your chair whenever you're working remotely. Next is a list of, I believe it's 24 FAQs, and this is questions and answers regarding your questions about working remotely from home. And in the very bottom, I have something that I just added just recently, resume tips of how you should actually format your resume, as well as what you should have in mind. So I always want to make sure that you have your platforms that you've worked on. So if you know Epic or Microsoft Office, Cerner, Protouch, Meditech, you want to promote your tech savviness, because when you're working from home, you have to be tech savvy with having to set up your computer, your laptop with your 2 monitors. You may also have a docking station, and they'll give you instructions on how to do all that. Some companies will have a QR code you can scan on your phone, and it will bring you to a YouTube channel, and it'll give you all the steps you'll need to set up your computer. And then other companies will have something where they'll have a printout, and they'll teach you how to connect your laptop with your 2 monitors, and then your keyboard, your headset, your mouse, etc. And here's an example of how you want to have your resume set up. You want to focus on what you did, why it's important, and how it relates to the job you want. Now, because I have experience in utilization management, this is the example that I have. And also, I have a bedside nurse versus insurance nurse and how they relate. So both the bedside nurse and insurance nurse have very similar roles, but what one person does and one person reads. So the bedside nurse has a patient, the insurance nurse has a member, they have diagnosis, doctor's orders, and what interqual criteria is. So you can read that at your leisure. And at the very bottom, if you are interested, I don't have any affiliation with interqual or with MCG, but if you are interested in any kind of certification, interqual and MCG does have certification courses, and I believe that both these courses are delivered live in real time, and they have the same exact pricing. This it's kind of fuzzy, but if you were to go to either site, and if you want to also research on Reddit to see if anyone has actually taken these courses, I haven't seen anyone recently, but whatever job you do work for, they will teach you how to use MCG and interqual. Coral Health is hiring a clinical review specialist. This is an active, unrestricted RN license required. It is remote. It was posted 3 days ago, and it is a part-time position. You must be within the United States, and the requirements are an active, unrestricted RN license. A compact license is preferred. A minimum of 3 to 5 years clinical experience, 2+ years of utilization review, appeals, or clinical review experience, strong knowledge of medical necessity criteria and payor guidelines, experience writing appeals letters, experience reviewing inpatient and/or outpatient hospital claims, proficiency with EMRs and review platforms. Epic is preferred. Strong written clinical documentation and time management skills. Experience with payor appeals, medical necessity, no authorization, and readmissions. Familiarity with interqual, MCG, or payor-specific criteria. Prior remote clinical review experience. Multi-client or vendor-side experience. And knowledge of Medicare, Medicaid, and commercial payor processes. This position requires you to actually have more experience. And then this last company is W3R Consulting. They are hiring a nurse case management senior analyst. This was posted on March 26th. This is for RN or LPN. And for this position, they don't have any requirements. It basically just states you must have an RN and current unrestricted nursing license is required. They didn't mention an LPN here, but don't mention exactly what type of LPN license is needed here. I would apply anyway. And the job just provides you a description of delivering specific delegated tasks assigned by a supervisor in a nurse case management job family. So we're not going to go over all the description, but you must be at least an LPN or an RN.